Hi, thank you so much for stopping by the channel. Cancer has claimed a lot of life, and I think the earlier we put awareness there, the better. So we are going to talk about some of the signs or some of the symptoms you should pay attention to. If you start experiencing them, they may be a sign of cancer. Without wasting your time, let's get into the video. So yeah, there are different types of cancer. We'll talk about four of the types, but then some of the general symptoms you may experience is fatigue, constant or persistent fatigue. You are always tired, you are all like, pay attention to it. Persistent pain, either general body pain or pain at a particular part of the body, pay attention to it. And also unexplained weight loss. You are just there and you are losing weight. You are not heartbroken, you are not thinking about anything, but you are just losing weight. Or you know somebody who is just losing weight by heart. It's about time you pay attention to that. It may be a sign of cancer. Your body is telling you something. Pay attention to what your body is telling you. Now let's move on to some of the specific cancers and the signs you should look out for. The first specific cancer we want to talk about, the most common one, is breast cancer. Bro, people ignore this, and by the time they realize it's too late. The first thing you should pay attention to is the size of your breast or the shape of your breast. You know how your breast is already. If you start noticing any change in the shape or the size, you should seek medical help. A discharge from the breast or the nipple. If you are not breastfeeding, I don't see why there should be any discharge from the breast. So if you are not breastfeeding, that breast milk will come out. If you see any other discharge, go to the hospital. It's better to be safe than sorry. Yeah, go to the hospital, let them check it for you. The last one is lump in the breast or thickening at the under. If you feel the skin here has become a bit too thick compared to maybe the other side. If you compare the two, one has become thicker than the other. Or if you lump, you know how to do the breast examination, right? You can check it on YouTube, but then per what I know, just raise your hand and you try to check if there's any lump. If there's no lump, you are good to go. But if there's any lump or you feel any unusual pain when you are doing the breast self-examination check, you should go to the hospital. It's better to go for the healthcare providers to check your breast for you, analyze your breast for you. We have Breast Cancer Awareness Day. Don't sit at home, go and let them check your breast for you. The next type of cancer I want to look at is lung cancer. So if you see these symptoms, you should know that it may be a sign your body is telling you you're about to get lung cancer. The first one is persistent coughing that is not going. Like you are coughing, you've taken all the cough mixtures, you've done whatever you're supposed to do, the cough is not going. Bro, seek medical help. The next one is chest pain. You feel pains in your chest, especially when you take in deep breath, seek medical help. And then shortness of breath. There are some medications, the side effect is shortness of breath. So if you are taking a particular medication, read on the leaflet. If not, and you are just there and you start feeling you have difficulty in breathing, you should seek medical help because it may be a sign of lung cancer. Okay. The next common cancer we have is skin cancer. This skin cancer is common, but it's not common because you hardly hear people talking about it. So some of the things you will see on your body that will indicate you may be getting skin cancer is sore that do not heal. You have a particular sore on your body that is not healing, or you know somebody who has a sore. The sore is not healing. It's been months, it's been a year, the sore is not healing. Ignore the files, okay? If the sore is not healing, then it may be a sign of skin cancer. And also some rashes or new growth of spots on the skin. Like if you experience this, all of a sudden you have some big pimples, some spots, no, go to the hospital, let them check for it. Maybe don't just say, oh, it's just a rash, oh, it's just a spot. Oh no, go to the hospital, let them check for you. Like I said, it's better to be safe than sorry. Let them check for you and know that it's just a normal rash. Okay, I'm not saying when you see small rash, take it to the hospital, no, but then there's this rash that probably it came and it's never going, or it gives you some severe pain, or it's unusual. try and go to the hospital. The last one under the cancers is colorectal cancer, the cancer in the rectum. So some of the signs you may experience is blood in your stool. If you're experiencing blood in your stool, it may be a sign of cancer. Constipation or indigestion. You are constipating, your food is not digesting. Did I say digesting? Anyways, whatever it is, if you are experiencing any of these, it may be a sign. And sometimes too, when you visit the loo, when you go to the toilet and you want to empty your bowl, you realize that you sit there for a while. You may think you have finished. When you get up, it looks like there's some inside you. If you're experiencing this, it may be a sign of colorectal, I'm sure I've mentioned it well, cancer. So yeah, go and get yourself checked. These are some of the symptoms you may see for some of these cancers. But then there are some uncommon symptoms that you may not have heard of, or you may not have seen somebody experience. Some of these symptoms are persistent headache. It may be a migraine, it may be anything, but just to be on the safer side, if you keep getting headache constantly that you can't explain, go to the hospital, let them check for you. The next one is blood in your urine or change in your urine. If you see changes in your urine or see blood in your urine, it may be a sign of cancer. So go and let them check. The last one is difficult swallowing. If you have difficulty swallowing, especially most of the time you get difficulty swallowing if you have sore throat. But then some of the sore throat, it comes and it's not going. Bro, don't sit there and be taking vitamin C and say, oh, I'm just taking vitamin C. After days, after weeks, if it's still not going, go and get yourself checked. So sore throat, difficulty swallowing or indigestion, which will lead to constipation. So if you have this constipation that's for days, don't come and say, oh, my constipation is normal, I constipate no, nobody constipates a lot. Your body is meant to excrete whatever you take in, I think within 24 hours or within 8 hours or something. So it's supposed to come out. Either you are not eating fruit or you are getting cancer. Yes. And remember that early detection is a good, like when you see it early, is good for your treatment. If you see it early, if it is detected early, it's good. You can get treated through chemo and all those their skirmishes. They can do it for you. There are a lot of people that have survived cancer. Cancer is treatable. Cancer is survivable, if that's a word. But if you sit at the home, I was going to say if you sit at home. If you sit at home for way too long, it may be too late to treat it. And I don't want to hear you are going. I need you to be watching my video. So yeah, go and get yourself checked. Go and check yourself, okay? And yeah, thank you so much if you've watched up to this point. Remember, this is informative purpose only. I'm just sharing my view based on little research and my little science background and human anatomy. If you have any problem, please go to the hospital, get yourself checked. Talk to a healthcare provider. Let them give you the proper diagnosis. Don't go and sit down and say, because I said this, maybe that's why maybe you have cancer because I said this. But if you're experiencing any of the signs I've mentioned for more than a week, like it's continuous for weeks or days, please go and get yourself checked. It's better to be safe than sorry. It's better for you to go and they will tell you, oh, it's nothing done. For you to go and they will tell you, oh, it's too late, you should have come early. Nobody wants to hear that, okay? So yeah, thank you so much. And my name is Pama. And if you did enjoy the video, please don't forget to subscribe and give this video a thumbs up. And turn on your post notifications so that you'll be notified the moment I upload content like this. And I'll see you guys in the next video. Peace out.